Hey everyone, this is Ben with RegisteredNurseRN.com, and in this video I'm going to talk about an occupational therapy aide and the salary, the job overview, and the education requirements. In a previous video I talked about occupational therapy assistants, and then in my next video I'm going to talk about occupational therapists. So you may want to check that out and get to know what they do and the types of salaries that you can expect. Now, what is it that an occupational therapy aide actually does on the job? Well, these individuals prepare treatment areas such as setting up therapy equipment, transporting patients. They will also clean equipment in areas for the occupational therapist so that they can work. They will help patients with billing and insurance forms, and they'll also perform a lot of clerical tasks like scheduling appointments or answering phone calls and things like that. Now, if you want to become an occupational therapy aide, you have to keep in mind this is kind of more like an entry-level position. You have the aide, then you have the assistant, and then you have the actual occupational therapist. Now, the BLS.gov does predict a 30% growth rate between 2012 and 2022, which is good, but there's not a lot of demand for this position. They only estimate that about 3,000 jobs will be added within that 10-year period. So there's not a huge demand, but it will increase a little bit, about 3,000 jobs added, so that's good. But again, this is entry-level position. Not all states have a position like this available in a lot of hospitals and so forth. So it's a good way to get your foot in the door and maybe become an assistant or an occupational therapist later on. It's some great experience. Now, if you want to become one, you typically have to have a high school diploma or a GED equivalent. And that's usually all you have to have. Most hospitals or healthcare facilities will actually provide on-the-job training, and they will train you to do these clerical tasks and to set up areas and so forth. And also, a lot of places like you to have CPR certification, so that may be something that you also want to look into. Now, let's talk about the salary information for this position, because that's what we always want to know, right? All these figures that I'm about to talk about are good as of 2014, and they come from the Bureau of Labor Statistics. That's the government agency that compiles and records jobs data. Now, the average wage for an aide as of 2014 was $13.96 per hour. The average salary, $29,040. Now, keep in mind, those are just averages. Some people will make less starting out. Some people will make a little more. It all just kind of depends on your experience, the state in which you live, the industry in which you work, and so forth. So I'm going to talk about some of those factors. First of all, what industry had the highest level of employment for this position? Offices of other health practitioners came in at number one at $25,200. General medical and surgical hospitals came in at number two with $32,870, and then nursing care facilities came in at number three with $31,780. Now, what were the top paying industries? The top paying industry was home health care services at $49,440. General medical and surgical hospitals came in at number two, again $32,870. And then the state government, believe it or not, came in at number three at $32,620. Now again, that can vary depending on which the state in which you live. The top paying state, District of Columbia, $44,560 was the average salary. California came in at number two, $37,710. And then Ohio came in at number three at $36,420. The lowest states, Arizona, $21,630. Illinois at $22,580. And then Iowa at $23,380. Now, if you want to know the data for all 50 states, I will put a link down in the description of this video, and you can go to an article on our website, RegisteredNurseRN.com, and I have an article that gives this general overview I've just talked about. And it has the data for all 50 states if you're interested and want to see what your state has. So thank you so much for watching. Again, you may want to check out those other videos, and please consider subscribing to our channel. Have a great day.